Okay, good morning, student. Do you still remember what we discussed on our last class? What we discussed in our last class, Virginia? Darshana, what we discussed in our last class?
Symptom of urea.
What was the topic, the chapter that we discussed? The chapter, the name of the chapter?
Congenital and inherited renal disease.
Okay, okay. Okay, let's continue with that. Oh, can you see the screen? Student, can you see the screen?
Yes, ma'am.
Yes, ma'am.
Okay, keep on responding. Okay, whoever won't respond, I will keep on asking the question that person. So we have completed till, I guess we have completed till here, the symptoms of URA, right? Srijana, right? We have completed till here, isn't it? URA symptoms.
Yes, ma'am.
Okay, okay, and okay, then let's continue with this. Okay, is it visible now?
Yes, ma'am.
Okay, so we have already discussed the symptoms of URA. So now we will be discussing the another symptoms, that is the symptoms of BRA, that is bilateral renal agenesis. So let us see what are the symptoms that we find under this disease. So number one is widely separated eyes with skin fold over the upper eyelid. That means like between the eye, isn't it? There will be so much of gap, means widely separated eyes. दो चौक का बीच में बहुत सारा गैप होगा, separated. The widely separated eye along with skin fold over the upper eyelid. Upper eyelid ka, like above the upper eyelid, there will be skin fold. So these symptoms you will see if a child or a person suffer from bilateral renal agenesis. So let us move on. The other one is air that are set low. That means what do you mean by air that are set low? It means that low set air, these are the the clinical features in which the ears are positions lower on the head than usual. Means the position of our ear, that is the position of the ear, will not be in the normal position. Instead, the ear will be positioned lower on the head than usually it used to be positions. That is what air that are set low means. So this kind of feature, it is mainly present in many congenital conditions. So that is the second symptoms that you will see in BRA. And coming to the next point, the next point is nose that is pressed, flat, and broad. This one I will show you the picture. I have the picture later on. The nose that is pressed, flat, and broad means like your normally our nose is like all the normal persons, like our nose is a little bit kind of like pointed, isn't it? But what happened to the person or the child who suffer from BRA? Normally their nose used to be flat, and it don't used to be pointed. It used to be flat as well as broad. It don't used to be thin. Like our normal nose is like a kind of little bit thin and it's pointed. So those kind of feature you won't see in BRA child. So the next point is receding chin. What do you mean by receding chin? Receding chin, you can simply call it as retrogenia. Means don't get confused, okay? The other name of receding chin, it is retrogenia. It means that, what do you mean by receding chin? It means that your chin does not project outward far enough. This also, I have the picture I will be showing you. And this lead to an unattractive pressure profile, because what happened is that like the normal chin we have, it won't be like that. It won't project like that. Instead, it will project outward far enough. Means your chin, it does not project outward far enough. Means when I will show you the picture, at the time you will like understand the meaning of this. So, and the next is limb defect. Limb. Do you know what are limb? Srijana, can you tell me what is limb?
Ma'am, hand and legs.
Yes, the hand and leg. Very good. Do we have upper limb and lower limb? Do we have?
Yes, ma'am.
So what happened in the congenital malformation, that is congenital defect, what happened is that there will be a like malformation, okay, in which one or more limb develop incompletely. That means we have our hand and leg, it's not it, but what happened in BRA, like the one or else the more limb, this will develop incompletely, or it will not at all develop. I have the picture of this also, I'll be showing all. So you see the 5 points that I have given you. If you have any question, you can ask now. One is the widely separated, these ears that are set low, nose that is pressed flat and broad, receding chin, limb defect. If you have any doubts from these symptoms of BRA, then you can ask me now. You have any symptoms? You have any doubts? Or I'll continue showing the picture. I'll show the picture. Yes or no? Okay, first of all, I have the picture of this. What is this? What is this? What did I explain here? The nose that is pressed flat and broad. It's not it. This is, see, this is our normal nose. And this is the nose that is pressed flat, and as well as it is broad. This kind of symptoms is seen in BRA. If a person suffer from like have a disease of BRA, can you differentiate? This is the normal and this is the abnormal one. Can you see the difference? Yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. This was the one, and the other one is, this is the receding chin, this one. Can you see now? Do you understand the receding chin? This
Yes, ma'am.
this is our normal chin. It's not, it, see, it look very nice. Can you see? Our normal chin, it look very nice. And see, this is the abnormal one. Can you see the difference? Yes or no? Okay.
Yes,
Okay.
yes, ma'am.
And then the other one is limb defect. All this now, they used to do surgery and all this. And then the other ones, this one is the limb defect. Limb means our hand and like our this leg is not it. So like there will be a like a limb defect, polydactyl. That means how many finger we normally have. How many finger we normally have in our like in our level? 5, isn't it? So how much you can see here? 1, 2, 3, 4, 5, 6 is not it? Isn't it? All this kind of defect is known as the limb defect. Okay, this is the polydactyl. It is known as polydactyl. I think there is a one hero like in the Bollywood who have 6 fingers. Who was that? He have extra.
Hrithik Roshan.
Yes, yes, all those are like kind of limb defect, you know, like that is seen. It's not bad, but still that are the example. See, all this here also you can see this is known as phocomelia. All these are, the name are not that much required for you all. I just want to show that limb defect, how does it is seen like this. See here also, see the toes, this is attached, it's not separated, but normally our every toe is separated. Like see, this is not separated. And see all this see here also, and this also. This is the kind of defect that you will see if a child have BRA disease. Understand? Yes or no? Yes or no?
Yes, ma'am.
Okay, shall we move on? Shall we move on?
Yes, ma'am.
Okay, okay.
Yes, ma'am.
Okay,
Yes, ma'am.
let us move on. The next will be the diagnosis of congenital disease of the kidney. Let us see all those congenital diseases that we have discussed. There is PKD, polycystic kidney disease, URA, and as well as right now we have discussed BRA. Now all those the congenital disease that I have given to you. How we will diagnose all these disease. So let us discuss one by one. So the first is the diagnosis of the congenital kidney disease can be done by using one or more of the following tests. So first is blood tests. So in order to diagnose that a child or a person have congenital disease, then first of all you have to do a blood test. So in blood test, a sample of a child blood will be taken. Means blood will be withdrawn from the child and then will be analyzed in a laboratory. Understand? This is the first diagnostic test that you need to do or you need to perform. Do you get it? Yes or no?
Yes, ma'am.
Okay, let us move on. Next is urinalysis. This is a sample of child urine will be analyzed in the laboratory. Here also you will collect a sample of urine from the child and then you will analyze in the laboratory. Then you will find out the defect. So that is the next test. And the third one is ultrasound. Why ultrasound is performed? An ultrasound may be performed to examine kidney structure. Okay, it means to examine whether the kidney structure, the structure of the kidney is normal or not. Is there any defect or any malformation is there? And then and functions without using radiation. And this ultrasound, it is mainly function without doing any radiation. So this is how like ultrasound is being performed to examine kidney structure. So that was the three diagnostic criteria that we find. The other one is the computed tomography. So simply we used to tell CT scan, is not it? So a computed tomography scan may be performed to look for abnormalities in the kidney. So the CT scan is done. They used to scan the kidney, whether they used to scan the kidney to find out whether there is any abnormalities or not. So that is the other diagnostic criteria. And the other one is the MRI. We simply call it as MRI. So the meaning of MRI is magnetic resonance imaging. So it may be used to create detailed image of the kidney without using radiation. Here also, like in ultrasound also without using radiation, and here also without using radiation. And here what they do is that they will like this is mainly done, you know, to create the detailed image of the kidney. So these are the diagnostic criteria that you will perform in order to diagnose that like a child have any congenital disease of the kidney or not. So do you get all this? Do you understand everything? 1, 2, 3, 4, 5. I have given you 5. Do you understand?
Yes, ma'am.
Yes or no?
Yes, ma'am.
Okay, then
Yes, ma'am.
let us move on.
Yes, ma'am.
Okay, let us move on. So the next is we will be discussing about the treatment. Okay, the next is we will be discussing about the treatment. So I would like to give you all a little bit of introductions. Like there is no cure, okay, for congenital disease of the kidney. There is no cure. And this condition required lifelong monitoring and treatment because that disease, particular defect, congenital, like it is from birth. It's not it. That's why there is no cure for any like congenital disease of the kidney. And this condition will require lifelong monitoring and treatment. And as a general rule, if your child has polycystic kidney disease, URA or BRA, he or she should avoid contact sport, any extracurricular activities like sport in which direct impact or trauma, that is injury to the back or abdomen, is likely. So a child should also follow a low sodium diet to help with high blood pressure management. So that was the little bit the introductory part that I would like to give you all. So now let us discuss one by one. So I have given you the three disease that comes under the congenital defect of the kidney. Is not it? That was PKD, URA, or BRA. So let us discuss one by one. So the first is, let us discuss about the treatment for polycystic kidney disease. So here, the first treatment is medicine. So a child should take a combination of prescription and over-the-counter medicine to manage his or her symptoms. So including what? Means, first of all, like a child should take a prescription. It's not whatever medicine that he or she will be having. No? Like he or she should not directly take or purchase from the market. Instead, he should take consultation or advice from the physician, from the doctor. The doctor, whatever the doctor prescribed, that only will be taken. And over-the-counter medicine to manage his or her symptoms. What do you mean by over-the-counter? Do you have any idea? What do you mean by over-the-counter? Anyone? Over-the-counter, counter. Anyone, any idea? You can just share whatever idea you have. Over-the-counter. Over-the-counter. Any idea? Any idea?
No, ma'am.
Over the counter means like in the pharmacies and all, like the drug, or means like over the counter, these are the drug or the medicine that is sold directly to a consumer, okay, without a requirement for a prescription from a healthcare professionals. Means like you can directly take from the without any prescription. Also you can take directly the medicine, or you can purchase the medicines at the pharmacies. So this kind of medicine can also be taken in order to reduce the symptoms. So what does it include? What medicine does it include? Let us see. The blood pressure medicines to regulate high blood pressures, because in congenital defect we have seen the high blood pressure also, isn't it? That is why like the under these medicines it comes the medicine of the blood pressure also. So to reduce the high blood pressure medicines are taken. So what was the name of the blood pressure medicine that I have given you before? You have any idea? Blood pressure's medicine? Something, it was anti something. Say anti hyper something I give. Say antihypertensive drugs are given for what? Antihypertensive drugs are given for what?
Blood pressure.
Blood pressure. To reduce blood pressure. It's not it. So antihypertensive drug will be given to reduce the blood pressures. So this is the first medicine that will be taken. And the other one is antibiotic. So why do we give antibiotic? Like in any cases, I'm not talking about the congenital disease. For any cases, why we normally or usually take antibiotic? In order to, release any kind of infections that occur. That is the reason why we used to take antibiotic to reduce the infection. So here in this congenital disease, that is PKD, antibiotic is mainly taken in order to treat the urinary tract infection, because in the PKD we find that the cause was urinary tract infection. That is why we have to give this antibiotic in order to treat this kind of infections. So that this is the second point. Next is diuretic is given to remove excess fluid. This one also, how many times I gave during your offline class also, diuretic. It was like Shital. What was the name of the diuretic drug? Shital, what was the name of diuretic drug?
Furosemide.
Yes, very good. It was furosemide. Shrizana, furosemide. What was the other name of furosemide? What was the other name?
Lasix.
Yes, very good. Lasix. So all these Lasix, furosemide, all these are given in order to remove the excess fluid and salt to lower the blood pressure. So these are also given. Like diuretic is mainly given to remove the excess fluid that are present in our body. So again, pain medicine to reduce abnormal pain caused by inflamed kidney. Obviously, like we have seen flank pain, all these things, like abdominal pain, all these. In order to remove all this like pain, we have to give the like painkiller or any pain medicine that will be prescribed by the doctors. So these are the treatment that we can see under PKD. So you have any doubts regarding the 4 points that I have given to you? Any doubts? In exam, if I give you, write the treatment procedure for PKD, will you be able to write these 4 points? Yes or no?
Yes, ma'am.
Yes, ma'am.
Let's move on. Now, low sodium diet. Okay, like don't get confused. You see this point nicely, whatever I have given, see. First was medicine. It's not it I have given this dot. If you means like don't want to get confused, you can simply write 1. If you get any confused in writing this one, this dot, you can just write 1. Number 1, medicine. Under that, what it came? All this done. Next, let's come to the next. The next is this low sodium diet. You have to prescribe the low sodium diet also, okay? For PKD, polycystic kidney disease. In order to help control the blood pressure, your child should follow a diet that is low in salt. So what happened that in your home also, not like if your parents, if your mom, your dad, your sister, your cousin, if anyone have like high blood pressure, now you always need to suggest that like this, to have low intake of sodium diet, that is to take less amount of salt. So never instruct them to have salt. And if you found anyone having blood pressure and taking like lots of amount of salt in his diet, then you always like give a health education to them. So that is the low sodium diet. Let us come again. One is the drain insertion. This is also another treatment, okay? These are the treatment of PKD, drain insertion. So drain insertion, it is an interventional radiology procedure that allows the doctor to drain cysts in the kidney. So I already explained so many times what is cyst. What is cyst? I already explained. So Samuel, can you please tell me what was the cyst that I keep on explaining again and again? Cyst. Samuel, what is cyst? Cyst. Ilasara, what is cyst? Ilasara, what is cyst?
Abnormal growth in the kidney.
Yes, any abnormal growth in the kidney, okay. Like you can also simply call it, it's like a, what to say? It's like a sac type, okay, which contain the fluid. Understand? I have shown you the diagram. It's not it the normal kidney and the polycystic kidney that the round is there. I have shown now. That was all the cysts. So drain insertion, it is mainly done by the doctor in order to drain the cysts that occur in the kidney. So this is also one kind of treatment for polycystic kidney disease. So next is dialysis. Dialysis. So okay. Malvina, can you tell me what is dialysis? Dialysis, because this is also one of the treatment of PKD. Can you tell me what is dialysis, Malvina?
Removal of waste.
Okay. When? What organs, when it don't functions, then we do dialysis? What was the name of the organ?
Kidney.
Okay, very good. Okay. Dialysis, when the kidney are not performing their normal function, okay, of cleaning and filtering the blood, a machine can be used to do this work for them. And that machine is known as dialysis. So when your kidney is failed to perform, okay, their normal functions of filtering the waste product, filtering the blood, then dialysis is being done. Okay, let us see the last management. That is kidney transplant. Obviously, after dialysis, it's kidney transplant. So if both the kidney become non-functional, a kidney transplant may be good treatment option. Means like we have 2 kidneys, not it. Like, but out of these 2, if only one kidney is like good, then the other one with the process of dialysis, you can like still make it functions. But when both the kidney like are not functioning anymore, then the only process that you can apply is the transplantation of the kidney. Understand? Do you get the point of all the treatment of PKD? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, let us review back just one more time. So this was the first was medicine. I have given the 4-point, okay, done. Then the next is I have given you all the low sodium diet, the drain insertion, dialysis, and the kidney transplant. Okay, these are the treatment procedure you need to follow for PKD patient. Okay, let us move on. Let us move on. Now the treatment for URA includes, what was the full form of URA? What was Senkamchi? What was the full form of URA? Senkamchi, what was the full form of URA? Srijana, keep on taking attendance.
Unilateral renal agenesis.
Agenesis. Okay, okay, let's move on. Time is again short. Okay, no problem. Monitoring of symptoms. This for the treatment for URA includes. So monitoring the symptoms. First of all, we have to carefully monitor the child's symptoms, okay, to catch for any complication early. Means like whenever a child have any congenital disease, now the only process that is very much required is to detect or to diagnose the symptoms as early as possible. So monitoring, daily monitoring, and is very much essential in order to diagnose. So the next is annual test. Annual test. So what is annual test? A child should have his or her blood pressure read once a year. So we normally see the increase in blood pressure in studies. So what happens is that at least once in a year, a child should have his or her blood pressure read. Means a child का 1 साल पे at least एक बार उसका blood pressure check करना. ऐसा नहीं है कि like if he don't have any disease or any symptoms or whatever, you will just ignore it. So the best way is always check the blood pressures once in a year. So the blood test and a urinalysis should also be performed annually to check the health of the kidney. So blood test as well as a urinalysis, all these you should also perform annually, means in a year, to check the health of the kidney. So that's why we always say that to be free from any diseases, you know, the whole full body treatment is very full body analysis or checkup is very much essential. So all these annual tests, monitoring of symptoms should be done in order to treat for URA. Because it was unilateral, it's not it, only one side of the kidney was being affected, it's not it. So that is the reason why annual checking of kidney is very much essential. So let's move on. You understand, right, the treatment for URA? Yes or no?
Yes, ma'am.
Okay, let's move on. This is the treatment for BRA. The treatment for BRA include chronic peritoneal dialysis. That is, chronic peritoneal dialysis means a child will require chronic peritoneal dialysis until he or she is strong enough to receive a kidney transplant. So this is the treatment for BRA include. What was BRA? Ishan, what was BRA? That day I have explained. BRA, jaldi BRA. Time is very less.
Bilateral renal agenesis.
Okay,
Hello.
what was the meaning of BRA?
Ma'am, bilateral renal agenesis.
Okay. So these are the treatment. What is the this number one is the chronic peritoneal dialysis. It is done. So here a child will require chronic peritoneal dialysis. Okay, here the child will require dialysis for a longer period until he or she is strong enough to receive a kidney transplant. So I hope you understand. Next is kidney transplant. Once a child receives a donated kidney, he or she often live a relatively normal, healthy life. So almost, you know, everything are like kidney related. Nah? That is why normally the treatment are also almost similar. So here, this was the treatment of BRA, chronic peritoneal dialysis, and one is the kidney transplant. So all this we have discussed today, as the time is short now. And with this, we have end the topic of congenital renal disease. The next is I will be discussing about inherited renal disease in my next class. So whatever we have discussed today, you understand or not? Everyone? Whatever we have discussed today, you understand?
Yes, ma'am.
Okay. Anyone have any questions? It's very good to see today. I'm very happy because none of the students is absent. Today we have full house. Everyone is present, I guess. Right, Srijana? I can see this.
Yes, ma'am.
Okay, it's very nice. Anyone have any question to ask? Let us rewind back what we have discussed today. This was what I have discussed, the symptoms of BRA. And then all these are the pictures. Do you want all this picture? These are the diagnoses we discussed today. You can see it back. The blood test, urinalysis, ultrasound, computed tomography, MRI. And this was the treatment of PKD, medicine, all this. And the next was this, low sodium diet, drain insertion, dialysis, kidney transplant, all these things. Next, treatment of URA, monitoring of symptoms, annual tests, and lastly, the treatment for BRA, that is chronic peritoneal dialysis and kidney transplant. All this will come in your second sessional exam. So study nicely. You understand, right, today, class? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay, okay. Srijana, are you done with the attendance?
Yes, ma'am.
Okay. Okay, that's all for today. I will be sending the notes by today itself, okay? Whatever notes I'm sending, like please write it down because like I have completed the congenital, right? So this will be coming in your second sessional exam. Okay, then thank you everyone.
Thank you, ma'am.
Thank
Thank you, ma'am.